So if I was to go to a Tremp Pro clinic,
Right.
and I compared that to a trip to the regular doctor, the standard of care, the existing model,
Right.
what's the differentiator? If I showed up and I got 6 to 15 minutes with a doctor, what happens when I go to your clinic? I mean, how does that work?
Well, there's a lot of use of the term patient-centered out there in healthcare today, which is really not the case because it's all driven by the prescription pad, the insurance company, the actuaries, the whole thing.
Mm-hmm.
So we are completely, I don't want to call it patient-centered, we're outcome-driven, strictly outcome-driven. And the only way to get to a favorable outcome is to thoroughly understand the disease process.
It's assessing the person.
Yeah, so we start with history, environment, understanding from the best we can.
Environment in what way? Geographically, or how's
Geographic's important too,
Yeah,
because there are bacteria and viruses, like pellagra was a disease in the beginning of the 1900s in the South.
Mm-hmm.
So there are certain types of bacteria in Israel that aren't in the United States. So geography, it's not a big part. Our main focus is to look at your nutritional habits and your behavioral habits on a daily basis. But we are interested in where you travel.
Mm-hmm.
A classic example is the Rothschilds of England. Were patients. And Mrs. Rothschild had macular degeneration leading to Alzheimer's, and she had a bacterium from rats. She was in the tubes of London during the Nazi bombings. So she was infected in 1939.
Wow.
Her interior balance held it off to some extent, but eventually as she got older and her immune system broke down, it propagated. And
So how'd you test for that? Was that just blood work? Or?
blood work, and
And the normal clinic would never look at that. They would,
CSI, if you will, investigative medicine.
okay.
You see the macular degeneration, you know it's inflammatory, you know infections can cause this, you start asking questions, then you start doing blood tests. And when you get to the root, now you have a diagnosis. Now you have a bona fide diagnosis from which to treat. So,
It's fascinating stuff. I appreciate your time, Dr. Tom. Look forward to talking to you soon.
good enough. Thank you.
All right, thank you.